Hello, everyone, and welcome to the Happiness Journey with Dr. Dan podcast, where every journey is worth living. My name is Dr. Dan, and I'm your host for today's episode. I'm a cognitive behavior psychotherapist specializing in anger management issues, both court appointed and private, marriage counseling, dissociative disorders, narcissistic personality disorders, depression, anxiety, dream analysis, and also provide life, business, and retirement coaching support. I provide individual one-on-one session and also do group settings. If you need any assistance, reach out to DMV Therapy and Coaching Services at 301-325-1550. And our website is lifecoachdanamzalak.com. Today, I'm very excited to have for our first episode of season 6, a very special guest, John Perry. And just like every of my past episode, I will leave it up to the guests to properly introduce themselves, as no one can do a better job. Josh, the floor is yours.
Thanks, Dr. Dan. I appreciate you having me and giving me the time to speak today. And it's a pleasure to connect and see your face.
Same here, Josh.
I guess long story short, what ultimately connected us, is my journey that I've been through. And it started out with, growing up in Northeast of America and, getting into school sports, team sports, and then growing up in like a trade focused area. It led me to playing all the sports, ultimately finding BMX and, the trade aspect of where I grew up. That led me to going to a technical high school, like a trade high school, to learn a trade. And I saw that as an opportunity to learn a trade and start a business one day. But also on the back end, I knew there was an opportunity come my sophomore year where I could go 2 weeks to academics and 2 weeks to work and actually get credit for school and make money and further my progression with owning my own business one day. And I loved being outside, loved working with my hands, taking something that someone would say looks, a little beaten down or, whatever, where they would describe it, and turning into something beautiful that I was proud of. And it also was an opportunity for me to make money and to fuel my BMX dream. So there's a lot of travel involved, a lot of expenses. And, ultimately I was able to be successful in both areas. And I turned professional at 17, which led me to dropping out of high school and leaving my well-paying job at a young teenager age with the support of my parents, which was really surprising to me. But I showed them the initiative to work hard, to focus, to stay out of trouble. And because of that dream, that vision for that dream of BMX, it kept me congruent in all my behaviors. And so with that, I built a good amount of trust with my parents. So they believed in me and they supported that dream. And fast forward, 4 years later, I'm riding X Games. I'm in, some of the most elite, or the most elite BMX competitions around the world. And there comes a day where I'm training and I'm practicing a new trick and I fall and hit my head and I get knocked out. I have to go get an MRI. And this point was a year of me suffering internally and asking for scans of my brain. I didn't know the difference between MRI or CAT scan, X-ray. I just knew there was something wrong and I needed to get checked out. And that crash ultimately led to getting the MRI that was necessary, that I've been asking for about a year. And I thought I was just going in for, post-concussion follow-up. They're going to tell me, hey, another week or two off the bike, it could be worse. And it did get worse. I drove there with that understanding of just concussion protocol follow-up, no big deal. And I was by myself. I was 21 at the time, been living away from my family down in North Carolina for about 3 or 4 years now at that point. And I got the news that, hey, there's something in your brain that shouldn't be there. And I remember laughing out loud saying, what do you mean there's something in my brain that shouldn't be there? I can't possibly have put something in there. So what does that mean? And they went on to tell me, there's a mass in your brain. There's a brain tumor. And at this point, we don't know if it's benign or cancerous, but we do know if you want to preserve your life, we have to have surgery done immediately. And there's probably a good chance you'll never ride your bike again. So in my mind, I heard cancer, never going to ride your bike again, you may die. And I decided, unconsciously, I checked out. It was one of those out of body experiences that was real for me in that moment. And that's ultimately led me on this journey of auditing how I was living my life, what I wanted to be true, and what behaviors I was participating in, and if they were congruent or not to the outcomes I ultimately wanted. And long story short with that, I went through, it was about a week and a half from diagnosis to surgery. My surgeon saw my case as so critical. He actually moved some patients out of the way to get me in sooner. And 6-hour surgery, was it 70 staples, 16 stitches, 4 titanium screws in my skull later, I was back on my bike in 5 weeks. And that was the first moment that really taught me the importance of auditing where we are and where we're trying to go and what we need to do or change to get to that point. And fast forwarding to, what is it, 12 years later now, I'm 6 months out of a second brain surgery. I was awake for this one. And I've learned a lot, and it's ultimately changed my perspective on how I live my life and the purpose of what I'm, doing with my life. And that ultimately led me to walking away from my dream that I was living as a professional BMX athlete, 2017, to pursue a higher purpose that I deemed necessary for my life, which was to contribute to society and the world at large. And so I left my BMX career that I'd worked so hard for and dedicated and sacrificed everything for this new journey. And I, at the same time, was it like a couple of years prior to that decision, I'd gone through a health coaching certification program, and I became really passionate about nutrition and optimizing human health. And I decided to leave that dream I was living as a BMX athlete to start a health coaching career, and didn't know how that would look, what to do. I knew exactly what I wanted to do and why that was so. And I took that leap of faith and I made it happen. And here we are today. I have a health coaching business. I'm speaking around the world now. Things look a little different the last 2 years because of COVID and all that. So it's been more virtual, or all virtual. But ultimately, I'm living my purpose, and I feel more fulfilled than I did throughout that journey of BMX, because I also learned BMX was a double-edged sword for me. I grew up very insecure of my being, a lot of trauma at a young age, and BMX was my safety net, and it was a place I could express myself confidently. And that ultimately led me to, realizing my dream and saving my life, literally, and taught me a lot, brought a lot of people from around the world into my life that brought me to who I'm engaged to and share a life with. So very positive. But at the point of transitioning to a new career, I found a lot of identity crisis and the imposter syndrome and all those things. And any challenge that came up, I went back to my bike like I did as a young child and developed that association. And I started to realize, man, like this is like harming my efforts. I'm no longer required to ride to earn an income. I have no obligation to, I have no sponsors anymore. I dropped all that and I moved on, but I'm still going back to this place of mastery, this place of confidence. And I recognize that. And this month is 2 years since I have stepped foot on my bike on a ramp. And it's been a really, really profound experience of learning who I am and the essence of what I possess that allowed me to excel on my bike. And I've just harnessed all those learnings and those awareness pieces and continue to do the work every day. As a living human being, the work doesn't stop, and you know that very well. And I've applied all that to my purpose in life and optimizing how I move forward. So, what started out as a childhood dream, I realized, made it happen, literally and figuratively saved my life in many different ways. And it's put me on the path that I'm on today at 33 years old, fulfilling my purpose and helping other people succeed. And there's no better feeling than that. And I know you can experience that as well, or you have those experiences as well. There's no better feeling than someone saying thank you for whatever it was that you helped them in whatever aspect of their life excel. And that's what I have dedicated my life to doing today. And that's what led us to connecting. And I just appreciate the opportunity to share and to help other people just change their perspective. And that's ultimately my main intention, is to utilize the lens of my life and what I've gone through and allow people the opportunity to see a different perspective and make that proactive shift to change whatever aspect of their life, because ultimately I didn't have that choice. I was forced to change every which way, inside and out. And I'm thankful for that. It put me on the path I'm on today. And 3 different diagnoses, 2 surgeries later, here I am. And it's my mission to empower the people to see beyond their circumstances with the things I've learned and how they can apply it in their own micro of their lives.
Wow, Josh, that is definitely an incredible journey. Now, the second time around that you had the surgery, is it because the first time they were not able to remove all the mass, so it grew back, or it was a completely different case?
So it's a combination. So to be clear, April 2010 was the first surgery. And it was 2 years later, 2 areas grew back. And the surgeon has said it was because of the tumor wrapped around the artery in my brain and my optic nerve, that he suggested it was probably just residual cell growth, because they weren't able to get all the tissue away, because the risk of hitting either one of those would result in a 2-page document I had to sign off of a risk with death at the top and stroke and paralysis right below it. And so with that second occurrence, I used gamma knife radiotherapy to basically zap the 2 tumors that grew back. And for 4 years, they shrunk. Start of 2017, 2 new masses on the other side popped up. And that's when they said they think it's a genetic, component here. And I remember learning about epigenetics and the ability to change the expression of our genes through lifestyle choices and different things like that. And so I went all in on doing everything I had learned. And thankfully, I came across a book called Brain Brain by Dr. David Perlmutter back in 2013 that talked about epigenetics and the ability to express our genes differently with lifestyle choices. And he focused on blood sugar regulation and the profound effects of a ketogenic diet for a tool. And so I went all in on that way of living, and for 2 years saw no progression. And then was it May of 2021, I had a seizure one night in my sleep and got rushed into the emergency room, got an MRI. And that's when they revealed that the 4 tumors that were there, the 2 from the original surgery and the 2 that had been popped up, none of them really, I don't think there was any progression with those, but a 5th mass had been presented. And it was a little bit larger than a golf ball. And it was in the frontal lobe, basically in the center of the 2 hemispheres, more to the left of my frontal lobe. And that's when they suggested that's what was causing the seizure to happen. It made a lot of sense when I saw the image and what I learned from it. So the second surgery in August of 2021 was I guess it came about because of that 5th mass that was causing the seizures. But the reason we did it awake was because Dr. Q at Mayo Clinic, he prefers to do that approach because they can be more aggressive with the surgery itself. They have a lot of brain mapping probes. They can test different areas. And I actually got to participate in the surgery, which, to a lot of people may sound crazy, may sound, scary. It definitely was all of those for me going through it. But it was a really cool thing to be able to experience, like participating in my own surgery. And because of that, Dr. Q was able to get the 5th golf ball, a little bit larger size tumor out, and all the other tumors that were in there that had been dormant or had been slowly progressing for many years. So for the first time in about 13 years, I have finally changed the narrative of my life, my story, that I'm no longer living with tumors. For many years, I shared that story. My name is so-and-so, and I have, multiple brain tumors. And that was an empowering story to share. But now learning about the unconscious mind and things like that, I'm also realizing it was fueling a lot of my own fears at an unconscious level. And so now I'm happy to say, 13 years later, I finally, tumor free.
Now, the masses, do they usually compress the side of the brain, or especially if it was on the frontal cortex side? Does it press, and does it give you any headaches? Did you feel that it was there? Because if it wasn't for the accident or the fall that you had, you would have never known, and that probably would have killed you.
Yeah, exactly. That's what my surgeon, he flat out said. He gave me another 2 months of suffering. And then he's like, man, you may have not woken up, given 2-3 months. But yeah, the first one, there was a year of suffering. Like I mentioned earlier, there was just debilitating headaches and migraines, and the progression throughout the year. It started out as like when you wake up sometimes, your eyes are kind of foggy and you rub them and it's like, it gets clear. It started to progress to where it was like that every other day or so for different periods of time, to where towards the end of that year, it got so bad that like my vision was just doubled and blurry all the time, to where I was riding purely off of muscle memory. Because I was going in, they're telling me, you don't need a scan, you're 21, you're a professional athlete, you're in shape, blood work doesn't show anything. Like there's no reason to give you a scan. Here's some pain pills, come back if you need more. Lo and behold, I didn't have a pain pill deficiency. I actually had a tumor taking out a large portion of my brain and killing me. So that crash actually revealed the evidence, the root cause of my symptoms. Now, fast forwarding the second occurrence, which was in 2012, it was thankful to an MRI. They just revealed, hey, you got some, I think they were about a blueberry size or smaller at the time, each of them that were growing. The third time, another routine scan. I didn't even know the 2 additional on the other side. Now, the 5th time or the 4th time with the 5th tumor, there was, now reflecting on that year leading up to that moment, there was some headaches on and off. But I, contributed that to maybe some stress related things. It wasn't anything like comparable to the first experience. The seizure was the main symptom that actually led to the MRI. And they were like, oh, there's something definitely going on. And thankfully, because of that seizure, we got to the root cause and sorted it out.
Was there any chemotherapy in the process, Josh? Or that was not even something that they considered that it would be helpful?
No, there was none. There was the gamma knife radiation therapy in 2012. And beyond that, no, because they have still been said to be benign meningioma tumors. So the meninges layer, the skull and spinal cord are where these tumors are most common, and they grow from that layer into the brain. So they don't actually develop in the brain like a different form of like a malignant aggressive tumor, like a glioblastoma. The meninges layer, it actually starts there of the skull or the spinal cord. Thankfully, I don't have spinal cord tumors, or I haven't, but it grows from that layer into the brain. So it actually puts that pressure that you're asking about into the brain. And the different tumors I had, the original one was like this long, like my scar starts here and goes all the way back. And it was like 8 centimeters long by 4 wide and 4 deep. And so it was putting a lot of pressure, especially on the prefrontal cortex and the different aspects of that. And then the most recent one was growing in that area, putting pressure in such a place that it was disrupting communication. And now, like I said, reflecting back, there was some signs there, but I just, I had, again, this is a double-edged sword. I had taken on the identity that I'm able to overcome. And I just was, trying to be strong mentally and physically, and I was ignoring some of the symptoms. And so, yeah, there was, because of the type of tumor, it was compressing slowly and putting pressure on the brain in various aspects, which was creating the understanding of the visibility issues I was having, the headaches, the nausea, and all that, so on and so forth. So there was a lot there.
But it didn't change any of your motor skills. For that, you were able to function properly. You were able to not feel any numbness in your hands or your leg. Everything was okay there. So it just was mostly on the front side of your skull.
Yeah, so the most recent one, it was in the frontal lobe, and it wasn't affecting any motor skills, but that's also why they wanted me to be awake in the surgery, because I vividly remember them waking me up and saying, hey, we needed you to move your right leg, your right arm. We need you to talk to us during this. Do you feel anything? You shouldn't, but just, I had to actually participate because they want to make sure that what they were doing wasn't going to affect the motor skills and things like that, speech, and all, hearing, sounds, or that's the same thing, but visibility, and all those things. So it was really interesting and weird, but it was to make sure what they were doing wasn't going to affect motor commands and different aspects of my being an able human that I am today.
So here's my question, and I'm sure that a lot of listeners will ask this: the fact that you participated in the surgery, how does that exactly work? I mean, they numb the brain so you don't feel the poking inside, but if they numb the brain, won't that affect you in responding on how to move the right hand, because everything is numb? How do they do the surgery when you're awake and you have to basically respond without feeling the pain of them shoving the needles, etc.? How does that work exactly?
So the first step was, before I even got into the OR, they did 4 injections to numb every aspect of like my head, so to speak. So I remember I sent my fiance a video when because of COVID restrictions, she wasn't able to come back with me. I sent her a video because I was like, I don't feel anything, but like I had, the relaxing medication they gave me, whatever it is. I just passed out before they even did the injections. And there was a funny story about the nurses, talking about, because I have tattoos and that, those are the guys that usually, are the worst with needles. And I was like, I'm fine with needles. And then when it came down to it, I guess whatever they gave me to relax, I just passed out. So I didn't even get to feel or experience them injecting me. With Gamma Knife in 2012, I was awake and fully coherent from them screwing like the anchors of the frame into my skull. This time, didn't feel anything, but when I woke up, I was like, I forgot, like I was thinking, I was like, where are my eyebrows? I couldn't feel anything. And I just was like touching them. And I was like, I feel like I can, and I literally was touching my eyeball because I was like, I feel like I can't feel anything, which is what it was meant to do. So that was a funny story, and sending videos to my fiance, but that was the first step, was numbing everything they could. Now going into surgery, the only time I've ever been awake and seeing everything in the OR, because normally you're asleep by that time. So I was laying on the bed, saw all the surgical tools, the lights and everything, and the smells. And they gave me an IV of whatever the medication's called to help you relax and ease, any anxiety and things like that. And I remember, Dr. Q coming in, saying what's up. And there's a nurse in front of me that I'm communicating with and going back and forth with. And then I remember drifting off and then coming to with them actually cutting my skull open. I don't know exactly how it works, but I think because from what they were explaining to me, those injections prior to numbing everything, and then the local anesthesia at certain levels to keep me in and out of coherence and consciousness, it was allowing me to wake up at certain times, depending on the level. And what Dr. Q was saying is like, if you feel anything, any sharpness, any pain, you tell me and we'll stop. And I learned, similar to my mom, I blow through anesthesia really quick. So there was moments where I actually sensed this like sharpness in my brain, and I would communicate to the nurse, everything would stop, and they would give me a little bit more, and then I'd be fine. And so the first thing I remember waking up after drifting off right before they started the surgery was waking up to them actually cutting into, or first taking out the old screws and then cutting into the skull. And it's the most bizarre feeling because you don't feel anything except for your body like just vibrating, and you could hear, and like it's weird to explain because I could feel like this grinding sensation of them actually cutting through my skull, but there was no pain. There was no like real feeling. I could perceive that. And then that was the first, the screws getting taken out, the cutting into the skull, like this grinding sensation. And then there was like 2 or 3 moments that I vividly remember, like a sharpness. It's so hard to explain because, obviously the brain can't feel, it just perceives. And like, I don't even know how to put it into words, but I could sense like a sharpness, and I would communicate that with the nurse. Dr. Q would stop, they give me a little bit more anesthesia, and then we go back to work. And then towards the end, I drifted off back to sleep, and I woke up in the ICU and saw my fiance, and I was like, oh, I guess it was successful. Cool.
And how long did the surgery actually last? The second one, when you were awake, when they had to keep you participating in the surgery, was it like a 2 hour, 3 hour? Because it was like a golf ball size. That must
Yeah.
would have come to.
I believe they said, because all said and done, open to close was about 3.5 hours. And I think they said it was, the surgery itself was about 2.5, 3-ish hours, but then it was 2.5 to 2:45, and it was about 45 minutes of them, closing everything up and all that. So in total, however it actually worked out, in total, it was about 3.5 hours start to finish. And then I was in the ICU, and Jackie, my fiance, said it was about maybe 3 hours later that I actually came to, and she got to see me in the ICU and things like that. But yeah, it's strange to be in this like dream state, and you're coherent, but you're not feeling anything, and you communicate and you're moving your body. And that was necessary for them to do the job. And, an MRI the next day revealed that there was no signs of any tissue and no damage, no healthy tissue taken. And obviously they can't morally say it got 100%, but Dr. Q is like, hey, we got 99.9%. Like, I'm confident to say that. And we're just going to monitor it because, with my history and the genetic, predisposition, apparently, like, we're going to monitor it year after year. And, with technology now and science advancement and information, there's so many ways of going about treating it. So I'm actually involved in 3 different studies, I believe, right now, to where they tested my entire genome and the tissue of the tumor and the genome of that. So we can, as science evolves and we learn more, if this does happen again in 10, 15 years, this or that route may be more appropriate than the other because of different things and correlations and, my own personal history. So it's pretty remarkable. And I'm just beyond amazed that within that time frame, 4 years ago, I met Dr. Q through mutual connection, just our passion for brain health and helping other people. And so when the diagnosis came and I needed to have a second surgery, I was like, hey, I know a guy. Yeah. At the same time, I was moving to Florida, an hour 15 south of where he is in Jacksonville at Mayo Clinic, to where I live today in Port Orange. And that was the middle of June. And my surgery was set, once my health insurance switched over, it was set for August 26th. And so It was just so many synergistic aspects of my life become so much more apparent as I reflect. And then as I take that perspective, and I, when things happen, it's life. I'm a human. The objective isn't to just be one way or the other, good or bad, like happy or sad. It's to, in my mind, to be as objective and as neutral as possible, because then we can see beyond the circumstances and all the resources that are in our possession. And had I been in that fearful victim mentality like the first time, which is understandable, I may have not even remembered that I knew Dr. Q and I had a relationship with him. So there's just so many parallels of just so many wonderful things that have happened from such a thing that someone would deem sad, or I've been asked, isn't that the worst thing that ever happened to you? My perspective is no, because it changed me and put me on this path I am today, which I'm able to provide and contribute to society in the way I deem valuable, and others gain value from my experiences. So to me, it was the best wake-up call, honestly. Well, each and every one of them, to be quite frank.
Now, after this journey, like this medical journey that was very, very bleak, how long did it take you to recover and to really kind of like find yourself and change your career to becoming a health coach, usually, like, what was the process at this point?
Yeah. So, okay. So the first surgery, I was back on my bike in 5 weeks, and it was about a year until I felt really confident that, well, one, in my ability, and two, that I'd be okay. And I just kept reliving the motion of just doing what I did. And then slowly, by, participating what I believed in, the belief was solidified. Now, the second time around, because of that, and it was 2 years later, going through the gamma knife, treatment and all that, it was a little less shocking, in the context of like fear and anxiety and the victim mentality. It was just like, all right, I've done this once. It's not so bad this time. And it was the same mentality, like, all right, I just treat it like an injury. Tell me, all right, doc, what do I do? What's the recovery like? And let's do it. Let's just get it done. And let's completely looking forward. The third diagnosis, I told you, no treatment at that point. We just monitored it. I took everything I could that I've been learning about epigenetics and lifestyle and nutrition and fitness and mindfulness and meditate, all those things. And I just built a plan and put it into place. The third, the fourth one, which was the second surgery, it was about a year and a half of me leaving BMX at that point and to search for who I was. I had lived this life for, more than half my life, identifying as what I did, as in the BMX athlete. I ride BMX professionally. Anyone that asks me, hey, what do you do? Proudly say, oh, I'm a BMX athlete. And I purposely, on my own terms, walked away from that to explore who I was, because this new path of health coaching and speaking, I was like, who am I to do this? Like, I'm the BMX athlete. I'm not like a coach. Like, a lot of my clients are older than me too. But because I have the knowledge, they see the value. And I couldn't see that. And so I was like, all right, I realized, I was very conscious that I'm going back to my safety net, that BMX. That's not serving me anymore. So I took that step away. A year and a half later was a seizure. And then that led to the surgery. And then now I'm confident to say, I have, the desire to get back on my bike is there because it's what I did. So I still love it. I enjoy, I watch my friends in the contests and things like that, but I don't need to get back on my bike because I found out who I am and the essence of who I am and the qualities that I possess that allowed me to do what I did at the level I did and excel at something that, what is it, like not even 1% of the population becomes a professional athlete of any sport. I was a part of that 1% or less. And so, understand the qualities that I'm passionate, I'm driven, I'm obsessed about things, and all these attributes of me, I've learned to, shift that into a different purpose, which is to help people. And that's not on self, it's off self, it's on purpose. And that whole thing just made so much sense and gave me so much clarity and alleviated so much baggage away from me, and the weight was lifted. And it was because of these certain circumstances I went through that my nature was to audit why is this happening? What can I do about it? Not, poor me, why is this happening to me? In that context, it was, what can I learn from this? Mm-hmm. Every year that went on, it was just solidifying that belief of, let's take this and let's take the positive learnings from this. Let's empower myself so that way I can help other people do the same without needing such a catastrophic event occur in their lives to wake up and change, because sometimes it's too late. In my case, I was, lucky enough, fortunate enough, whatever word you want to use to fill in the blank, to be where I am today. And I don't take that for granted. And I love helping people, get out of their circumstances, no matter how painful it is. I've been in tremendous amount of pain that I don't think the vast majority of the population can even fathom, which I inflicted on myself to do a thing I loved, which was ride BMX. It comes with injuries. It comes with falling 20 feet to the ground and pain on a regular basis. Like, the first 6 months off my bike, there was all these lingering injuries coming out, and it was terrible. And now I feel better than I have since I was 16. So all that to say is I learned a lot, and that's what I pour into with anything I do, whether it's, having these conversations, it's my own content creation, it's my clients, it's everything, it's speaking. I want to empower people with the things I wish I knew at those times, because it would have made my journey, obviously we can't say for sure, but I believe it would have made my journey a little bit more different or beneficial in terms of where I wanted to go. And I can't change the past. All I can do is look forward. And I want to be able to help other people, especially the younger generation, learn these things that I had to learn the hard way, and how easy it is, or I should say how simple it is for them to implement these strategies to then be able to, optimize their life and ultimately, realize their goals and their dreams.
Well, I guess in your case, we can comfortably say what doesn't kill you can only make you stronger.
Exactly. Definitely. But you have to see it that way.
Yes.
That's the challenge. That's the most difficult part. Is it's simple. It's just not easy because there's so many, mental and emotional aspects built into it. To see that perspective, it's going to take that moment for someone to wake up. And I had those wake up calls, and I use that as leverage to help other people have a wake up call moment for them in the context of my story and my helping them shift their perspective, because my belief is shit could always be worse. And I've seen that happen multiple times in my life. And I don't want people to have to go through that route. Not saying that people, will take something away from my story and not experience suffering or pain at all. That's not the objective. Like, that's a part of being a human. You're going to experience up and downs, good and bad, pain and, joy, things like that. But how we handle it, in my mind, shortens the amount of time that we experience that pain or suffering. And we can shorten it, or we can extend it. It depends on our level of consciousness and awareness, which is consciousness to the circumstances that we're going through, and what's the gifts that are actually bound up in that circumstance, no matter how painful it is.
So to all our listeners out there, Josh, what would be your key recommendation, especially if someone is going through something similar, either cancer or any of the tumors, whatever it is, how for them to, you said it's very hard to be able to kind of like reprocess everything that you've gone through in your life. What is your next step or your next journey after you get cured, etc.? Or those who are actually going through it right now, how can you be positive? How can you put yourself in a positive mood when everything around you is just a disaster? So it's easier said than done. But you recommend, especially that you went through some pretty much chaos regarding your medical status, etc. So what would be the key recommendation for them to be able to kind of like not really focus too much on the victim mentality, but kind of say, okay, what am I learning from all this?
Yeah. It's just that, it's just ask questions. And the first question I pose to anyone, whether they're in the circumstance or they're realizing there's a problem in their life, is asking yourself, creating that vision, asking yourself, what do you want to be true about yourself and your life, ultimately your reality? And then you can take that question and whatever comes out, you can find incongruencies of, what you say you want to be true about yourself and your life. And then you can take a second step, which would be, okay, what are some problems that I have in my life? And then you can see the incongruencies of behavior. So for me, it was, visualizing, okay, here's the reality. Now visualize beyond that. What do I want to be true? Well, I want to wake up from surgery. I want to be recovered. I want to go back to living my life on my own terms, living my dream. And so I just got really focused on the difference of what if I wake up versus what will I do when I wake up. There's a vast difference of that, emotionally speaking. So I went all in on focusing on the vision. And that, I think, is the number one challenge people have, because the circumstances are real. They're painful, mentally, emotionally, physically. I've been there in many different situations, and I can confidently say that they are. The difference of experiencing that on a level of that's preventing you from seeing beyond it is getting clear on what that vision is for you. And sometimes it's hard to see that vision. And that's why I like to ask people, okay, what do you want to be true about your life? Let's start there. Let's create this vision by asking questions. What do you want to be true about yourself and your life? And step number two, ultimately, so if you have what you want to be true about you and your life, and then you have, what does that look like? What does that feel like? Who are you doing this, this life with? Where are you? Getting clear on that mental image or that mental movie in your mind, that elicits the emotions that will, empower us, or people like to label us motivation, that'll motivate us to see beyond the circumstances and to believe ultimately that we'll be okay and that we'll overcome. And so it's on the surface, it's very simple. And I have a lot of deep systems and processes that I help my clients go through that I've learned and that have passed down to me over time. But on the surface, it's just starting out, what does that vision look like? Who's in that vision? What are you doing? Where are you? What do you feel? What are you thinking? And then from there, it's like, okay, how do I make that happen? What would it take to make that vision come to life? And it's easier said than done, but that ultimately can help project you into that moment, and you'll feel those emotions, and that'll trigger the behavior that you participate in and ultimately create the reality. And so with that said, there's a quick little exercise I love sharing called the TEAR method. You start with your thoughts, because our thoughts are triggering the emotions we feel. That influences the behavior or the actions that we take. And then that creates the reality or the results that we see in our life. So, you can start with either one of them. You can go up and down. But if on the surface, if we start with the T, is your thoughts. What are you thinking? because then you can trace that back to what are you feeling. And then you can easily see the actions you're taking, the behavior you're participating in, and the results you're getting or the reality you're experiencing in your life. And you can use that method to tear down whatever circumstances you're in. And then you can create new thoughts, which will elicit new emotions, which will elicit or influence new actions, which will create a new reality. And it may take some time to get to an ideal reality, but that process is super simple. It's just a matter of making the decision to participate in it.
But this is where the laws of attraction falls. Thoughts becomes the things, but in between the thoughts and things, you have action and belief. But here's one thing as well, Josh. A lot of people will say, well, that's great for him that he was able to heal fast, etc. But you're also an athlete. So the thing is that if you had other medical issues, if you were overweight or not active, chances are it would have been a much worse case scenario. But because you were active, you were exercising every day, you were taking care of your health, you were eating properly, that kind of sped up your recovery. But the thing is, not everyone, as you said, it's only 1% that are athletes in this planet. Not everyone have your luck or have your ability to be able to heal much faster. So many listeners will say, well, that's great for him, but I am not him. I am not as healthy as him. So, but you also did say something that after your surgeries, etc., you went into studying epigenetics. You went into the keto diet. And as you know, keto will obviously figure out to be able to fight any illnesses, cancer, because keto is like low carbohydrate, basically. And you allow your body to be able to utilize the fat storage to be able to create energy and not, eat from the muscles. So the thing is that not a lot of people are really into those extreme diets, because it is an extreme diet. When you have to eat under 20 grams of carbohydrates per day, no one is in a good mood with that. So again, is the willingness that you've taken to be able to make a change in your life that not a lot of people are willing to do either. So again, the thoughts, the behaviors, action, etc., will accelerate your healing. But again, it starts with the thoughts. So you cannot change your behavior without even thinking about what was your thought originally.
Yeah, and there's a lot in that, because keto is just a short for a metabolic state, and there's many ways to approach this metabolic state. And something that gets missed, especially in the mainstream conversation, is the adaptation process that it takes for the mitochondria to actually understand how to break down fat and utilize it to create ATP in an efficient manner. So the withdrawal effects that people label as keto flu actually doesn't become apparent. Yes. And that's what I learned about metabolic health and how we can optimize those things with something as simple as people understand, like, okay, so, ketogenic diet is, you're low carb, ultra low carb. They don't understand when you do that for a certain amount of time, your kidneys start to excrete water at such a rate that your glycogen stores come down as well, which excretes more water, and then you lose electrolytes. Electrolytes are electrical signaling molecules. So something as simple as supplementing with the proper amounts of sodium can help alleviate all the, the withdrawal effects and so on and so forth. So I've taken a deep approach to that, and becoming friends with like Dr. Don Biagostino and Dr. Ryan Lowry and Sean Wells, like the experts in metabolic health and specializing in the ketogenic approach, because there's a lot of misunderstandings. And I went through those, and I learned the hard way. So a lot of what I do today is help people be proactive in these different tools. If they want to go down the keto route, cool, let's understand why, what's appealing about it, and let's do it appropriately. Now, on the other end of the spectrum, with the other topic that you mentioned up about, oh, that's good for him, he was an athlete, I was living the most unathletic life that you could ever imagine besides a sport I participated in. I mentioned that year leading to the diagnosis, which came from the fall and the concussion that led to the MRI. I was hiding up a lot of the suffering with my success, and then drinking alcohol at a young age every night, pretty much, because the pain was getting so bad that I learned every 2 or 3 beers or drinks, the pain would go away. And so what people saw on the surface wasn't what I was actually experiencing. And that's what I had to work through with the whole identity aspect of how people perceive me and what I actually felt and wanted to express in the world. So I hid a lot of that, because I was eating, my view of nutrition was, there was no view. It was food is fuel. So what's cheapest and what tastes the best. So it was processed food. It was cheap junk food, 2 liters of Dr. Pepper a day, because that was cheaper than water, because I could buy a 2 liters of soda for 99 cents, but water was $1 for a little 12-ounce bottle. And then you add in onto the fire all the alcohol that was a pretty nightly, regularly every night type of thing. And then we'd go get milkshakes or whatever. But because my physical form didn't reflect my choices, I didn't think I had a problem until I got the diagnosis. And that's the difference of, what I talk about health being internal. In my case, I didn't develop diabetes. I developed a brain tumor. I didn't develop fat excessively on the external adipose tissue. Viscerally, it would have been interesting to see what kind of visceral fat I had with different images of my body, but I developed a brain tumor. So everyone's different. And that's where I learned a lot about epigenetics and bioindividuality. What's on the surface is just what's on the surface. It's like a book. You don't judge a book by its cover. In my case, the doctors were doing that. And lo and behold, like I said, I didn't have a pain pill deficiency. I actually had something severe going on. And so when I share different aspects that we've been talking about, I share from the lens of being proactive. And yeah, people could say, oh, well, he was an athlete, good for him. But the only thing about qualifying me as an athlete was I was participating in a physical activity on a regular basis. My diet didn't reflect that. There was no exercise beyond my sport. I wasn't in the gym or anything. And I was stressed out all the time. I was sleep deprived. I was partying way too much. I wasn't even focused on what I was doing. I was just doing it. And so when people say that to me is them copping out on the ability they have to change their life. And we do that unconsciously. We go, oh, that's good for them. Must be nice. That's telling yourself it's not going to be possible for you. Oh, he's an athlete. He was able to overcome. I've talked to other people that weren't athletes and they overcame things that were even more severe than I went through. They had a cancerous brain tumor. I didn't have cancer, thankfully. So it ultimately, my belief is whatever you believe about life, you're going to see projected into your reality and it's going to come back to you. Law of attraction, like it's whatever you believe unconsciously, you're going to unconsciously affirm to yourself by the decisions you make and the participation in life that you go and behave with. And so at the end of the day, it comes back to, my conversation of proactivity. What do you want to be true about your life and how can you make that happen? Those two questions are really simple but profound. If you're open and honest with yourself and you write out the question, what do I want to be true about myself and my reality? And you write a list, okay, what are the problems in my life? And then you see the direct correlation to all those things. Then you have a conscious decision to make. Do I want to change or do I want to stay here? Many people will consciously say, I want to change, but then their limiting beliefs, their subconscious programming that's built on the past then gets in the way. So that's where, neurolinguistic programming came into my life. I started to understand all these concepts and it's what I love helping my clients with and anyone that I have conversation with. I clearly get passionate about this topic because I was the victim for so long in my life. And today I do everything I can to take accountability for where I am. And I get inspiration from other people and other stories to move forward.
Well, ladies and gentlemen, you heard proactivity is key. And don't be reactive because sometimes reactive will put you in a really bad situation. Well, Josh, that is all the time that we have for today's podcast. I really do appreciate you taking the time out of your very busy schedule to join us. And thank you again for participating and inspiring our many listeners with your incredible story. Now, we hope that you have all enjoyed today's episode. And I'm also very excited about the many upcoming guests that we have scheduled for season 6 of the Happiness Journey podcast, filled with inspirational stories just like the one that you listened to today. Now, here are some concluding words of wisdom. Don't wait until you reach your goal to be proud of yourself. Be proud of your step every step forward you take reaching your goals. As you go on every day, you may not notice great changes, but it is with being consistent and keep on focusing on these baby steps that you will see imminent changes in the distant future. The only person that can control the journey is yourself. The only person that can give up on that journey is yourself. And the only person that can succeed is yourself. Which one will you choose? My name is Dr. Dan Amzalag, and you may all keep pursuing your amazing journey in life.